Your Y Country Medical Minute, as always, brought to you by the Cassopolis Family Clinic Network, gives you an opportunity to learn a little bit more about how you can be the healthier you that you want to be, maybe, and also learn a little bit more about some of the additional convenience factors that are had with some of our great organizations here in Southwest Michigan, specifically the Cassopolis Family Clinic Network. And today we bring in Kevin Klipowicz. I don't know if I said that right. Did I say that right?
You were close, Klipowicz. Yeah, very. I've heard much worse, so
All right.
kudos to you.
Yeah, just don't call me late for dinner, right? But Kevin, I appreciate you joining us. And actually, the conversation that we want to have today is really a lot to do with convenience factor. It also has a lot to do with maybe just kind of informing people what's available with the Cassopolis Family Clinic Network. So you actually are the director of pharmacy. Is that correct?
Correct. Yeah, I am the director of pharmacy here for the Cassopolis Family Clinic Network. I oversee two pharmacies. We have two locations. Our first one opened in 2015, and that is the Cassopolis Family Clinic Pharmacy. I started with CFCN in right about 2019 when we were just opening the health center here in Niles, and we opened the pharmacy here in Niles in February of 2020.
Okay. Wow. Okay. So this is kind of a cool thing because maybe we've heard about the growth, the expansion, we'll say, of the Cassopolis Family Clinic Network, but didn't realize all the aspects that have grown with it. And obviously, in your experience, you've been there for a while, but I'll just say from my experience going to, pick up prescriptions from a pharmacy, I know a little bit of it. I know that I show up and then my stuff should be there and then I go home. But really on a day-to-day basis, what exactly do you do there?
Well, I mean, the main thing is, yes, filling prescriptions, but it's more than just, counting some pills and slapping a label on there. We always need to check for interaction. So it's good to, stick to one pharmacy so we can check for any interaction, especially for a new medication. And also on new medications, we will do counseling. So if there's any side effects, interactions, and then also proper technique is something we deal with, especially if you're getting like an insulin, how to properly inject that, or an inhaler, how to properly use that. Along with that, the main thing we do also is working with our providers here at the Cassopolis Family Clinic Network, answering any questions that they have. We work with the patient's insurance, seeing if there's any, formulary issues. Say a doctor writes a prescription that's not covered. We can work with one of our providers here to make sure that they do get a medication that is covered. And finally, we do provide immunizations, mainly the shingles vaccine for any of our patients that are 50 and older. You don't need a prescription for that. You can walk in right off the street, come in, and we can give you that shingles vaccine for you.
Very cool. Okay. Now, I've got to ask this question because I think a lot of people might be thinking about it. What's the difference between Cassopolis Family Clinic Network Pharmacy and some of the other bigger pharmacies that are around?
Sure. I mean, the first is convenience. Being located right here in the clinic, having your prescription ready right when you literally check out of your appointment. You can walk right over to the pharmacy, and usually there's a little lag time, so we're able to have it ready by the time you're done, checked out. So you've had your appointment with your doctor, you walk out the door, you walk into the pharmacy, you walk right out. It is there and ready for you. Also with that is, like I said, if there's any issues with insurance, I can just walk right back to the provider and talk to them and let them know, hey, this drug's not covered. We need to get it switched to something that is, or if it requires like a prior authorization. We have someone in the pharmacy that works on that right away to make sure, the patient does not leave here without their medication. Some of the other services we do, like some of the big box, we have a drive-through that patients can come pick up their medication. Also, we do weekly courtesy refills, so patients do not have to worry about calling in refills, anything like that. We're able to fill it on a weekly basis when it's due for them. And then finally, the minute a prescription is ready, we can send them a text message letting them know, hey, the minute I check that prescription, everything's good to go. I hit enter, and it sends them a text message, hey, your prescription's here and ready for you.
Does it say your prescription's ready, LOL? Emoji.
I could probably put that in there. I'm gonna take note of that.
Yeah, think about it, right? What about costs? I mean, you mentioned that a little bit. Is that something that is comparable, or is it better?
Being a federally qualified health center, we have access to discounted drugs through the 340B program. Basically, we're able to purchase them really at a discounted rate and pass that savings along to our patients. The patients must qualify for our sliding fee discount. They meet with one of our community health workers and they'll sign them up for the plan. And it's not just pharmacy services that they can get through the sliding fee discount. They can do any of the clinic services that we offer here. So whether it be, seeing one of the medical providers or behavioral health or OB, we are all here and able to provide care at a definitely affordable rate for
cool.
patients.
All right. So, last, two questions I've gotten for you. First, why do you love being a part of the Cassopolis Family Clinic Network personally? And, is there anything else you would want to share with anybody who's hearing this and maybe considering Cassopolis Family Clinic Network?
Definitely. The reason why I love being a part of the Cassopolis Family Clinic Network is the integrated care model and patient-centered medical home we have here. Everybody is working hand in hand, all the providers, us pharmacists, nurses, to provide the best possible care under one roof. So we're making sure patients are able to get their medications right away after their appointment. And then anything else I'd like to share would be, if patients are looking for a new pharmacy, we are an open door pharmacy, meaning you do not have to be a patient of the clinic in order to get a prescription filled at our pharmacy. We are in contract with most insurance plans, all Medicare, Medicaid plans. If you're looking to transfer, from one of the other pharmacies in the area, all you have to do is give us a call. Our numbers are on our website, cassfamilyclinic.org, and we're able to call your pharmacy, get your prescriptions transferred, and fill them, right away for you. And then also, if any of our current patients are interested in our pharmacy, all you have to do is let your provider know before the end of your appointment to have your prescription sent to our pharmacy. And I can guarantee you'll notice the difference right away from filling a prescription at our pharmacy.
There you go. Straight from the mouth of the director of pharmacy. Kevin, I appreciate you, man. Thank you so much for enlightening us, letting us know a little bit more about what you do, but also the benefits and advantages of the Cassopolis Family Clinic Network Pharmacy. We'll talk to you soon, all right?
All right. Thank you, Matt.
Thank you. There you go. The Cassopolis Family Clinic Network brings you each Monday the Wide Country Medical Minute.